concussion is damage to the brain at the microscopic level. So oftentimes people will come in and be interested in MRIs or CT scans, but those scans are for things that happen at a little bit bigger level, so they're not going to show much in an injury from a concussion. But it's damage at the microscopic level where their cells communicate, and that will subsequently produce symptoms that people will notice. So the most specific symptom for a concussion is dizziness. So oftentimes if you see someone with a direct blow or whiplash injury to the head and they are dizzy, that's likely a concussion. However, the most common symptom is headache. How I explain it to patients and parents is that headaches also, though, can come from other things. So sometimes we have to figure out, is that truly a concussion or not? Typically, we're going to start with a history. What happened to the patient? We're going to figure out what kind of symptoms they had. Then we're going to do a physical exam, looking at memory, concentration, balance. We also want to rule out head bleeding as a cause, and so that's when we test the nerves inside the head to make sure there's no clear indication that we need a CT scan of the head. So I think the main ways that we can work on concussion prevention is being aware of how they can occur. There's no device that's out there that helps with concussion, such as mouthpieces or headgear that are sometimes touted as preventing concussion. Those have not been proven. They do help with dental injuries or with fractures or lacerations, but not with concussion itself. Neck strengthening has been seemed to be associated with a decrease in concussion simply because of less whiplash forces on the head itself. And as the athlete matures, they seem to be less likely to get a concussion. If you suspect an athlete has an injury, such as a concussion, you should remove them from play immediately. The CDC uses the motto, when in doubt, sit them out. So if there's any concern at all, you should remove that athlete so that they are not at risk for further injury. There is a rare condition that can sometimes happen called second impact syndrome, which can be fatal or cause brain damage if that brain is not protected and is injured a second time before it has started to heal. We subsequently then want to have them evaluated and to get them to a healthcare provider so they can be seen.